Hi, I'm Gerri, one of the respiratory therapists working at Huron Regional Medical Center. To become a respiratory therapist, I went to college for 2 years. I have my associate's degree and have worked as a respiratory therapist for close to 30 years. In South Dakota, you can go to SDSU to get your respiratory degree, which is a two-year degree. When I first became a respiratory therapist, I worked in larger hospitals and had excellent experience in the ICU and the neonatal intensive care unit, some of those things that you do in the bigger hospitals. Then I moved back to South Dakota and started working in smaller hospitals. And one of the things that I love about working in a smaller hospital is there are no 2 days that are the same. We work with all patients from the brand newly born to taking your last breath and help everything in between. As well as because we work in a critical care access hospital, we get to do the diagnostics also, such as stress tests, heart monitors, pulmonary function tests, which are tests of your lungs to see how you're breathing. We help with the ER. We go up to OB. We work on the medical floor. We work in surgery sometimes, recovery room, just about anywhere there is in the hospital that you have people, we have patients that we work with. One of the things I love about my job is actually working with the patients. Patients have such amazing stories and amazing backgrounds, and when you get to visiting with them, when we do breathing treatments, we're in their room for like 10 minutes at least. So we usually get to visit with them. When we're doing pulmonary function tests, we're with them for probably half hour or so. And so you get to visit with them and learn their life experiences. And I love my patients.
You mentioned you have an associate degree. Can you go for further education?
Yes, you can have a 4-year degree. Actually, some people even get their master's in respiratory care. So healthcare is a very good occupation to get into. You can usually start with a 2-year degree, make very good money, and enjoy helping people. So I encourage anyone that's looking at a healthcare occupation to look into respiratory.